Hi, it's Saturday 22nd of July and I'm here today with the Diabetes Research and Wellness Foundation for the 9th Diabetes Wellness Day South. We're here at the Solent Hotel in Whiteley for a fantastic day with over 150 delegates and a team of 40 to 50 healthcare professionals working in the field of diabetes and related health to provide an excellent awareness day and supported self-management for people with all forms of diabetes. Our delegates today are going to have an opportunity to talk to our healthcare professionals and learn top tips for really good self-management to avoid some of the complications that are related to diabetes.
Recognising that diabetes is a condition that affects lots of people, it's really important that those with diabetes are appropriately educated to live well with diabetes. The modern world is a place where most people living with diabetes have limited access to a specialist at regular intervals. And as such, it's critical people are empowered and are given the relevant educational skill set to manage their diabetes on a daily basis by themselves or with help from close at home support. Diabetes is by its nature a long-term condition. That's to say that when someone's diagnosed, they're likely to have that diagnosis with them for the following 30, 40 years and beyond, so for a very long time. And because the nature of diabetes can change over the years with advanced ageing, it's important people recognise that diabetes is with them for a long time and things may happen in their lives that could affect their diabetes. Alternatively, as they age, their diabetes may behave differently. So it's critical living for such a long time with such a condition, they know exactly what they need to be aware of on a daily basis, even without specialist involvement, so they know that what they're doing is right in terms of taking medications and making appropriate lifestyle dietary choices to promote good diabetes control, good care and good health. There's also recognising the need that various diabetes treatments may change over the years for various reasons.
Good diabetes self-management is key to my role within diabetes. I'm a podiatrist and I manage patients with a range of foot conditions, from very low-risk patients right up to acute foot disease. If they do get a complication, it's extremely important that they manage their diabetes really well to promote healing and resolution of their foot problem. Amputation rates unfortunately are increasing. There's 140 diabetes-related amputations per week in England, and that's gone up from an additional 5 per week from last year. Diabetes control is fundamental to this, but also good foot care, good access to timely foot care is needed, to foot care services, but also for patients to be empowered to actually ask for their annual review results. They should be screened for their diabetic foot risk, whether they're low, moderate or high, and they should then be informed what that means. We've asked patients this morning, there's probably 100% of patients say they've had their feet checked and screened, but nobody knew their foot risk. So unless you are told your foot risk and what that means to you, you can't take appropriate action. So I think days like this really empower patients to go back to primary care to ask for that and to ensure they're getting that.
This event provides a wonderful opportunity for people with diabetes to make new friends, which is essential to feeling supported in self-managing a long-term condition. We've spoken to a few delegates today to find out how their day has been.
I think every time I have come, I've learnt something different, yes. I meet so many different people with diabetes and it's nice to meet them again. Maybe I haven't seen them since last year and to find out how they're getting on, yes. I would advise anybody with diabetes to sign up for one of the Diabetes Wellness Days because it's not provided by the NHS and you get support from other people in the community and you find out what there is available.
I'm privileged to be involved for the last 9 years that the event has been running. I've worked very closely with the DRWF charity for a number of years, and what drives me to keep returning every year is the invitation, of course, but naturally the enthusiasm and the passion that the organisation have to promote better diabetes care for everyone. It's something I'm very signed up with, and it resonates well with my personal views on what diabetes care should be like for most people. So I'm very happy to be part of that process, working with allied colleagues, friends and teams who want to make diabetes care better for many.
No, this is my 6th or 7th Wellness Day event that I've been to. It's good to speak to the healthcare professionals here. You get to ask some questions on a more personal level about the different areas that they do in the healthcare profession. The one that I went to this morning was the Understanding Glucose talk, and it was a better way of understanding what our HbA1c blood tests are, what they're for and exactly what they show, because sometimes throughout the years you know what it is but you forget exactly what it's showing, so it was a better understanding.
I support the Diabetes Wellness Days South as I feel it's key to engage with patients. It's great to have it on a weekend that patients can come. I find it really valuable. I've really enjoyed being involved over the last few years. I enjoy presenting and then talking on a one-to-one basis. There's some really key messages I can give, and there's some really interesting questions that patients pose to us. The event helps to educate patients because we can have a chat over a coffee or a cup of tea. We can chat during the sessions, or they can come to the stand that we have downstairs. And I get a range of questions, right from really simple questions that I can resolve, right up to some complex questions that people are really challenged about their foot health needs, and they're really concerned about their outcomes. It's really nice having small groups, allowing them to ask questions, to interrupt, to go over, and to really sort of sound out what that information is. We're always available afterwards, so they can come up and talk one-to-one to us if they've got a personal question they want to ask, and if they don't feel that they're empowered or it's safe for them to ask that question in a larger forum.
The benefits of the wellness days, I think, is just better understanding of your care that you get from your consultants or your GPs, but also better understanding as a diabetic, why you have certain tests done, things that you can do yourself to help prevent complications, but also better management of your diabetes.
My name's Kelly. I have type 1 diabetes, and this is my third diabetes wellness event that I've attended. For me, it's about learning the shared experiences of others living with diabetes, so not just type 1, also type 2, and meeting other parents with children with type 1 diabetes or type 2 diabetes. So for me, peer support is very crucial in managing both type 1 and type 2 diabetes. You can access a wealth of knowledge and information from people who live with diabetes on 24/7 and actually gain their input and advice instead of just accessing your healthcare professional. So with peer support, you could access wealth of knowledge and experience for people who have lived through a certain experience, such as cycling a long distance. And for me, I've done that, and I can ask others who have gone through that experience about adaptations that they've made, any advice or hints or tips that they can give from someone who have diabetes.
The highlight today is finding out that a group are going to donate £400 to our charity, which helps people with diabetes in this area.
The highlight of the day for me so far has been meeting some others who live locally. So again, it's having that peer support that I think, oh, actually there's other people here who are living with both type 1 and type 2. And that's really important. Definitely recommend, definitely. There's so much experience and knowledge and support that you can gain both from peers, from healthcare professionals and from the charity itself, and the support that they can offer.